CareerBuilder is made for people who have that thing. You know, those superpowers that make you good at your job, the skills you bring to work. And CareerBuilder knows those skills make you right for other jobs too. Higher paying jobs with benefits. Jobs you never thought of trying. Are you a people person? Work from home as a customer service rep? Are you organized and like driving? Become a delivery driver. You have the skills it takes, and CareerBuilder.com has the jobs to get you hired fast. Visit CareerBuilder.com.
This is a CBC podcast.
Well, when you go for medical care, a lot of factors determine how well you'll do. But one simple thing can affect the outcome of your treatment, and it's totally within your power to change. It's whether you call people by name. Mary Jane Hampton's here to explain in this week's Health Hack. Mary Jane's a consultant and Information Morning's healthcare columnist. Good morning, Mary Jane.
Good morning, Portia.
Well, this seems obvious, but often overlooked. Why is it important to use someone's name?
Well, it is incredibly obvious. And if you think about it as a patient, what your name is the first question that you will be asked when you have an encounter in the healthcare system. But if you think about it, how often do you ask the name of the other person and then use it? And I'm talking now about every encounter point that you have in the healthcare system, from the people who greet you at reception to the people who book the appointment to begin with, right through to the people who are providing you with very intimate and personal care. And asking their name, I will bet you, is something that you don't do that often.
I was just using the healthcare system recently and found it incredibly helpful that nurses were wearing name tags, and it made it easy to remember to, address them by name. But asking might be another step. And are we talking about their first names or their surnames?
Yeah, well, there's some really interesting science behind names. And if you think about any time that you're in a very public space and you hear your name being mentioned, even though it may not be about you, your ears perk up because you've kind of got a hardwired trigger just to be more alert, to open another channel of communication. Same thing, happens when you hear a name on a loudspeaker, and if it's your name but then a completely different surname, you still perk up because you're just hardwired. So first names are important, and what's kind of interesting in healthcare is that for the most part, we are on a first name basis for a whole bunch of reasons with most of the touch points that we have in the system. So yeah, asking, even if there is a name tag, asking to hear the name is helpful because sometimes pronunciation really matters, and you want to get it right. But as soon as you use that name, there is just a moment that the other person's guard is down enough that there is even a measure of empathy that comes into the transaction, because suddenly you have created a personal connection. You've created an instant rapport, and that's going to count a lot, not only in that encounter, but if you come across that person again, which it's not unlikely in this health system, it's quite likely that they will have a fleeting familiarity of you. So you're not just a health card number anymore, you're actually a person. And that really matters in the quality of the relationships that you have.
And maybe that's a moment to introduce yourself too, what's your first name, and then saying yours in case it's not top of mind for them, and really cementing that connection. But what about with people who are in, the top position of authority in the healthcare chain, and that would be specialists and doctors? Do they want to be called by their first name, and should you do that?
A really good question. And what you call your doctor is a completely different kettle of fish for a whole bunch of reasons. In fact, I was so interested about how people go about this that I did a little informal poll of people that I know, and I asked them if they call their doctor by their doctor's first name. So, do you call Dr. Portia rather than anything else? And it was very interesting, the responses I got back. About 40% of women who responded back said that they don't call their doctor by their first name, and a very strong group of women respondents were really emphatic that they would never call their doctor by their first name, whereas over 60% of men who responded said that they're very comfortable calling their doctor by their first name, and they do it regularly. And it doesn't matter if the doctor is a male or a female. That doesn't seem to make any difference. Then I asked a group of doctors how they feel about their first name being used. And this was really, really interesting. About a third of the doctors responding said that they are really not at all comfortable with their first name being used. And for the most part, the doctors who aren't comfortable with their first name being used are female doctors. And they're least comfortable with older male patients calling them by their first name. So that would be, calling them Dr. Stephanie. I'm not even suggesting that it's just Stephanie, it's Dr. Stephanie. And the reasons that they gave were interesting. I mean, there were obvious reasons of boundaries. They think that it's really important in that doctor-patient relationship for there to be a friendly but not familiar. There needs to be a level of
respect,
trust, certainly, that's built. But a level of respect and objectivity. So it wasn't presented as a status issue. It was, or a power issue. It was really a reflection of role. And when you have a doctor in a relationship, you are looking to those individuals to provide you with objective advice. You don't want them kind of emotionally invested in your day-to-day care. You want them to be caring, but you want them to be objective. So those boundaries are really important, and there is clearly a very important consideration in names in that regard. So it is a completely different kettle of fish with doctors than with other members of the health team.
So this is a health hack that you can use if you're one of those people who feels really comfortable just launching in there and calling your doctor by their first name, to know that they may not want that. And maybe over time that changes.
Yeah, there was certainly a lot of feedback from physicians and from patients that say that the naming relationship changes as the relationship evolves. There are, doctors that if you've known for a really, really long time, you've had a long-term relationship with them, that it may morph into a less formal naming, and it may be that there are other doctors that said that if the patient I have used to be my teacher, or if it's somebody who I've known in other contexts, as I've grown and evolved, then sure, that's different. But it's important to have that conversation and not assume that it's okay to call them by their first name. I will say that some of the female physicians actually recounted some absolutely shocking examples of lack of respect and boundaries, particularly by male patients, and I was really, really surprised by that. So names matter, and relationships really begin with getting that right. So it's a two-part health hack. The first thing is any encounter that you have with anyone in the healthcare system that's a touch point, you need to figure out what name to use with them so that you can have that quick personal identification, and then always remember to thank them by name, because that can also make a difference to somebody having a really crappy day and knowing that the work that they're doing is important. And second, with a physician, you need to, when you meet them for the first time, you should ask them what they prefer to be called, and never assume that the name that you might pick for them is the one that they want, because you don't want to get that relationship off on an awkward foot. If you've known them for a long time, that might change, but that first encounter, it's important. Just ask the question and have the conversation.
Great advice, Mary Jane, and it's good to talk to you. I'll look forward to catching up with you again next week with another health hack.
Absolutely. Take care in the meantime.
You too. Bye-bye.
Bye.
That's Mary Jane Hampton, a consultant and our healthcare columnist here on Information Morning.
For more CBC podcasts, go to cbc.ca/podcasts.